Hello, I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society, and I'm pleased today to be joined by Dr. Holly Thomas. She's a women's health primary care doctor. She's an assistant professor at the University of Pittsburgh, and she's a clinical research on menopause and sexual health. Thank you for joining me today.
Oh, I'm glad to be joining you to talk about this important subject.
So, firstly, the phrase that I gave, menopause and sexual health, that for many women, as they transition through perimenopause and menopause, there's nobody to talk to, and there's often not even the realization that things can happen as a result of not only getting older and aging, but menopause itself. So, what is it that women should be aware of that might change during their perimenopausal transition and menopause itself?
Yeah, so you're right that I've heard this in my research and from my own patients that women don't really know what to expect when it comes to sexuality and aging because there's not enough communication, there's not enough research. So that's part of what I'm trying to do with my program of research. Um, there are a lot of different changes that can affect women's sexuality as they go through the midlife transition. And, some of these are more psychosocial changes. They may be going through changes in their personal life or their personal relationships that can impact their sexuality. But looking at more of the biologic factors. So, the reduction in hormones, particularly estrogen, that occurs when women go through menopause has a significant effect on the vaginal tissues and the tissues that surround that area. So, as women get further out from their last menstrual period, they can often have symptoms of vaginal dryness, vaginal itching, tightness, and even develop trouble with painful sex.
Now, for many women, because we often don't talk about this as we get older, it becomes sort of this conspiracy of silence, if you will. There's a sense that I must be alone, that this is not common, that whatever is going on with me is me and me alone. And therefore, I think it forces women to be even more withdrawn. So let's put a perspective on how common some of these issues may be.
Yes. So vaginal symptoms in postmenopausal women are exceedingly common. We kind of think of hot flashes as the most common symptom for menopausal women, but in truth, as women reach 5 or 10 years postmenopause, vaginal dryness is far and away the most common symptom. Studies show that like 50% or even up to 70% of postmenopausal women experience vaginal symptoms. So they're exceedingly common. And what a lot of women don't realize is that we have a whole range of safe and effective treatments to address these symptoms.
So you mentioned the dryness, which I think women are becoming a little bit more aware of, that this is not an aging event, but that this is an estrogen deficiency event. You in menopause, you're not making the hormones, and that's what happens. But what about other sexual problems that may be common? Are there any other things that crop up that women should be aware of?
Yes. So, another common symptom that women in my research, my own patients, and in other studies have experienced is changes in libido. So, it's common for women to report that their libido or their sex drive decreases as they move through their 40s, 50s, 60s, and beyond. Not all women are necessarily bothered by these changes. But for those who are, they can have a significant impact on their life and their relationships.
So often, as women, we don't necessarily bring it up, and a healthcare provider, be it a nurse practitioner, a practicing physician, OB-GYN, primary care, whatever, doesn't bring it up either. There's so many other issues on their agenda that they won't necessarily
Mhm.
bring it up. So it becomes that there's no really either identifiable place, I won't say a safe place, but an identifiable place to talk about this. So what tips can you give women in terms of opening the door to this conversation and not censoring themselves just because you have not been asked?
Yes. So it does take some courage to bring something like this up with your healthcare provider. Um, but the potential rewards are vast if you can find a treatment that's effective that will kind of give you the sex life that you're looking for. So I would say don't hesitate to bring it up with a healthcare provider. And even if that particular provider does not know how to handle your particular complaint, hopefully they will partner with you to find somebody who will.
So, in terms of treatment, just for women to be aware that there are different treatments available depending on what the distress or dysfunction might be. So what are some of the options that might be out there going forward that they can explore?
Yeah. So if the primary complaint is related to libido, um, then there are options, both pharmaceutical and non-pharmaceutical. We know that working with a sex therapist or participating in mindfulness-based interventions can be helpful for low libido, as well as some prescription options are available for low libido as well. And then if the primary complaint is more related to sexual pain or vaginal dryness, as we talked about, there are a whole range of prescription options, as well as pelvic floor physical therapy, which is working with a specially trained physical therapist to improve the health of the pelvic floor and make sex and other activities more comfortable for the patient.
So before I let you go, if you were to give one message to us as women who are transitioning through midlife and menopause and beyond, what would that message be?
Um, it would be, don't be afraid to ask. If you have a problem that's related to sex that is bothering you and having a negative impact on your life, don't be afraid to bring it up with your healthcare provider, because there are options available to help.
Thanks so much for joining me today.
My pleasure.
Bye for now.
Bye.